When you discover a penile deformity, the condition has been there for a few weeks or possibly months before, often with some discomfort. If it's a new deformity, this is Peyronie's disease. If it's always been there and someone's just pointed it out to you and you're young, it's likely to be a congenital curvature.
The first signs of Peyronie's disease can be pain with erection or a lump that's tender in the shaft, usually on the top. Anatomically, we call that the dorsal penile shaft. Generally, the inflammation and penile tenderness with erection goes away after 6 to 12 months. Unfortunately, as the inflammation subsides, it leaves behind a scar in the tunica, which causes deformity or bending with erection, and often penile shortening. Don't panic, but for this problem, you need to seek out a urologist. There's both medical treatment and surgery to address the penile bend or deformity. So if you feel a tender lump in the penis, or you have pain with erection, or you note a bend in your erection, it may be Peyronie's disease.
This penile deformity can be a Peyronie's disease, a benign disease, but it is interesting to see a neurologist because he or she can explain better this disease and guide the treatment.
First of all, do not panic. The first thing you should do if you think there is a deformity in your penis is to schedule a visit to a medical specialist in sexual medicine close to your area. This professional will perform an initial assessment of your condition and will have a precise diagnosis. After that, you will be explained about the treatment options that are suitable for your case.
In this scenario, having just found it's likely to be Peyronie's disease. It's obviously quite early stage Peyronie's disease, so there's no surgery contemplated, and we have to try and limit the amount of curvature that you're going to eventually end up with. So mechanical therapy with vacuum devices and stretchers. If you've got pain, there are some of us that will give some medical therapy, such as tamoxifen and tadalafil, to try and prevent progression of the curvature. But in the early stages, it's damage limitation. It is not a cancer. It's a very common condition. Don't be worried by it. It can be fixed. But clearly, the less curvature you have, if it does end up with a surgical procedure, then it'd be much easier to treat.